All right, thank you, Sarah, and thank you, everybody. I really am just so excited to be here and appreciate this opportunity to get to speak with you all about all of the just variety of work that we have been able to accomplish over the last 7 months. As Sarah mentioned, I am also a member of our Office of Emergency Services, which is a part of the Berkeley Fire Department. I actually joined this team just over a year ago and have been activated as the EOC coordinator for COVID-19 over the last 7 months. So as Sarah mentioned, before we really dive into some of the details and also just some of the stories and the pieces of work that I want to share with you all tonight, our activation started in the middle of January as a situation monitoring activation. We had staff from HHCS, our police department, our fire department, as well as staff from our public information office to be able to support us as we continue to learn more about this pandemic. As you all know, since then, this operation has incredibly expanded, really since March when we got our first confirmed COVID-19 case in the city. And let's start to talk a little bit more about what that looks like. Next slide, please. So to accomplish this, we've had 5 key focus areas that really focus on the umbrella of disease containment efforts to mitigate the spread of COVID-19 in the city of Berkeley. First, we've worked to establish and expand COVID-19 testing within our community through multiple partnerships. We've also implemented an incredible public information and outreach campaign to make sure everyone has accurate as well as up-to-date information about the pandemic's effects and all of the different ways that we can not only keep ourselves safe, but each other safe as well. We've also really just created some incredibly new programs to work with our vulnerable populations, specifically with our seniors, as well as our unhoused populations, to mitigate the spread of COVID-19, not only in congregate settings, but also in settings that may be encampment settings or other different types of isolation settings. We'll talk a little bit more about some of those details in a bit. Along with this, we've also supported our business and arts organizations through concerted efforts thanks to the leadership of the mayor, as well as our city council, and through direct outreach efforts through the city's emergency operations business outreach team. And then finally, to help with all of this, we have a massive cost recovery effort that has been mobilized in order to ensure that we have the maximum documentation required that is readily available and organized in order to help us get as much money reimbursed through the Federal Emergency Management Agency, or FEMA, for all of our different emergency expenditures. The work across these areas, as well as many more that I don't have the time to discuss tonight, has been made possible by over 550 employees who have activated to support this response as disaster service workers and expanded their day-to-day duties because of COVID-19. Staff mobilized directly for the EOC, as well as in support of expanded city operations, and they were able to accomplish items that would have taken months in days, and different programs and the creation of these programs that would have taken years in just months. So let's go to the next slide and talk a little bit more about the data that forms this context. So we've really been focused on a very data-driven approach led by our public health officer, Dr. Lisa B. Hernandez, as well as the science and research around COVID-19 to ensure that all of our programs, as well as our response actions, are taken in direct consideration with what the science says about this disease. So this first graph that you're seeing at the top is the new cases by date reported, as well as the 7-day average of positive COVID-19 cases as we move throughout the pandemic to date. You'll see that there are a couple of spikes in there. These spikes are primarily directly related to holiday gatherings, weekends when people wanted to hang out with friends or family when maybe isolating or a virtual opportunity may have been a little bit safer. These weekends were like Memorial Day, 4th of July, as well as Labor Day. However, if we look to our second graph, which is located just below it, we see the complete picture of our percent positive tests throughout the COVID-19 pandemic compared to our total tests reported within the city of Berkeley. And this graph really demonstrates not only how much our preventative actions have been helping to slow the disease spread, but also just how much we've been able to increase our COVID-19 testing capacity within Berkeley, especially through some of our direct partnerships. Next slide, please. So let's dive into that a little bit. This is our first major theme. So Testing was something that was incredibly hard to come by, especially in the March and April timeframe. During this time, testing was reserved for symptomatic individuals and also often symptomatic individuals who had been displaying symptoms for a long period of time prior to their ability to actually receive a test. Also during this time, the Centers for Disease Control, which is located in Atlanta, Georgia, was the only location that was processing and then delivering test results back. That may mean that someone had COVID-19 symptoms for up to a week, was finally able to receive a test, and then had to wait an additional 10 days to get that test result back. That's not exactly an acceptable solution to manage a pandemic. So we recognized this gap immediately, and our city was able to mobilize quickly as well as proactively to address this. I want to take this time to pause and thank the mayor as well as our city council and also our city manager and department leadership for just being incredibly visionary during this time and having amazingly open minds to establish something that had never been done before. Through this empowerment, we were able to create our first test site located at the West Berkeley Service Center, and it was established over just 5 days. This was a close partnership with UC Berkeley's Innovative Genomic Institute, as well as Lifelong Medical, a local organization that provides medical services primarily to underserved populations and especially those who don't have access to health insurance. Our site started out for essential workers and then expanded to symptomatic as well as asymptomatic or individuals who don't have or are not displaying COVID-19 symptoms, and then later on was completely reconfigured to be a mobile test site, which provided testing opportunities and brought testing opportunities directly to some of our most vulnerable and underserved populations who were less likely or unable to seek out testing through traditional resources, which later became either private partnerships or also through primary care providers. Through this targeted equity strategy of establishing a mobile testing operation, we were able to bring testing directly to our homeless shelters, skilled nursing facilities and long-term care facilities, local grocery stores, as well as coordinated events for our monolingual Spanish-speaking community members through close partnerships with one of our community resilience centers, the program that Sarah mentioned before, such as the Multicultural Institute, as well as Latinx Unidos, a connection that was directly facilitated by our mayor. Thank you very much. And we were also able to continue to work with many other local partners to enact this program. While we're doing this, the state also established that we needed to be able to meet a certain testing goal of having 245 tests per day. So to do this, we received and also established additional test sites through direct partnership with the city with 2 key organizations. The first one was established through OptumServe, which was a state-sponsored site that is still located in South Berkeley on Oregon Street, right next to Grove Park. I want to pause here, and I want to thank our public health officer, Dr. Hernandez, for just absolutely incredible advocacy work at the state level to ensure that our community, which is its own local health jurisdiction, was able to receive this resource that other local health jurisdictions were able to receive as well. This greatly increased our testing capacity, not only for our community members or those in surrounding areas, but also provided free tests to anyone, regardless of health insurance. This is an incredible resource to have, and it's still in operation today, providing over 130 tests to community members. Second, we established a pilot with a new organization called Curative Inc. This walk-up pilot has continued today and is located at the Berkeley Adult School, and they test over 240 people per day, and this organization does bill insurance. We're excited about what future partnerships may look like with both of these organizations. Finally, to wrap up this slide, with increasing the amount of data that we're getting, we need a way to respond to that. In order to do that, we increased the work of our disease containment branch, which was founded out of our communicable disease unit located in our HHCS, or Health, Housing, and Community Services department in the city. To do this, we activated and trained multiple disaster service workers. We trained nurses from the State Nurses Registry. We activated UC Berkeley volunteers, and we also received additional resources from the state to support these processes. However, we wanted to be able to support our community members to the best of our ability, especially those who have contracted COVID-19. This team goes above and beyond and also provides case management services to best support those who are having trouble with their isolation, which also has included meal deliveries through an expanded partnership of Meals on Wheels. We want to make sure that everyone is staying safe, of course, if they do get COVID-19, but we also want to make sure that you know that your city is supporting you during such a difficult and scary time. We have invested over $3 million to support this effort, and we are looking to continue to prevent the further spread of COVID-19 through adapting these policies and looking at how we can integrate these into our city operations looking forward. Before we move on, I want to extend a specific thanks to our disaster service workers who supported all of these EOC efforts within our testing expansion, especially those from HHCS, Public Works, the Fire Department, our Planning Department, the Berkeley Police Department, and also especially our parking enforcement officers who really helped us with some traffic control operations when we expanded our 6th Street test site to be a walk-up as well as a drive-up test site to help mitigate some of those effects, as well as our Berkeley Public Library staff. Let's go to the next slide. So shifting gears a little bit, let's talk about our work to support our vulnerable populations. As I mentioned earlier, this work has really focused on our seniors as well as the Berkeley unhoused population through quickly adopting our programs to the new COVID-19 protocols, as well as building and establishing completely new programs that had never been done before, given the needs that we were seeing. In regards to our work with our unhoused population, we have taken multiple steps to critically address gaps, as well as expand our services and the services of our partners during shelter in place. One of the first things we did was we expanded our shelter hours to be 24/7. This way, when we're telling people to shelter in place, those who are at our shelters are actually able to do so without mixing with the other members of the population and possibly increasing their risk or the risk of others at the shelter to get COVID-19. Along with that, we also supported our shelters with their decompression efforts. What this means is that we had a shelter with a certain number of people, and we needed to be able to space those people out safely so that we had proper physical distance between individuals as they were sleeping or living in the space, so that way we weren't exacerbating any possible disease spread. We also did this in partnerships with Alameda County. Alameda County provided opportunities for COVID-19 vulnerable residents to safely isolate at hotels known as Operation Safer Ground, primarily focused on those who are maybe a little bit older or have pre-existing health conditions that would compromise their health very quickly if they were to contract the disease, as well as for any of our unhoused population members who may actually have COVID-19 housed at a separate hotel, aptly named Operation Comfort. We actually have 2 of these hotels in Berkeley, both located on University Avenue, to help provide continued resources to our unhoused and very vulnerable populations. I want to mention that with these hotels, although they are temporary housing resources, the teams are working around the clock to help make sure that members of these programs can be provided with permanent housing opportunities as they move through the hotel program. Really just an incredible resource that has been stood up both in our community as well as around Alameda County. In Berkeley, I would like to specifically recognize the Berkeley Food and Housing Project, who is helping to support these hotels, as well as the 50 nurses that we have from Samuel Merritt University, who are providing critical healthcare support to our population that are located there. Along with this, we'll shift to talking a little bit about our outreach now. And we provided some key supplies such as hand sanitizer, especially when it was very high in demand and very hard to come by. We have also provided face coverings, both disposable as well as reusable, and we've also provided food and water. I want to touch on that piece a little bit because this was a gap that was previously filled with a lot of our community volunteer organizations. However, with shelter in place and the added risk of transmission through the pandemic and of COVID-19, we needed to really quickly act to fill this gap through a partnership with an organization called Double Helping Hands, as well as partnerships with other organizations supported through our EOC logistics operations to ensure that these population members were able to get access to not only clean water, but also hot meals, as well as sustainable non-perishable foods that they could have while they were out in the community to help them safely shelter in place. This is really important because we have been able to mitigate a particular effect of COVID-19 within an already vulnerable population by quickly taking action here. Along with that, we have also established additional resources to isolate our vulnerable members of our unhoused population. In April, prior to the 2 hotels that I described standing up, we really realized that we had a gap in how we would isolate someone who was either vulnerable to COVID-19 and protect them from other members of the community, or what to do if somebody got sick. So to quickly act on this, and thanks, I want to call out the leadership here of our EOC director, Paul Budenhagen, we were able to procure 18 trailers and establish 2 sites for these trailers, as well as refurbish a city-owned house located in West Berkeley. Establishing this program was led by disaster service workers who are working to support our EOC's Unhoused Support Branch, and they are located normally in their day jobs in our Housing and Community Services Division. We cannot thank them enough for their leadership and their expertise on this effort. Along with that, we're talking about building something quite literally from the ground up, which means that we needed a lot of infrastructure support, which was a huge lift from our city staff. I want to especially thank our Public Works, the Planning Department, as well as these efforts that were facilitated by our EOC Logistics section, which was staffed by disaster service workers from the Berkeley Police Department, Department of Information Technology, as well as the Berkeley Public Library. We have also established a closer partnership with the Berkeley Food and Housing Project, who not only are providing support to our hotels, but also to our respite sites as well. And on top of the wellness checks and the day-to-day support, they are also providing case management. Shifting gears a little bit, we have also expanded our support and reconfigured our programs for our senior populations. As most know, our senior centers are just incredible resources for our community. However, in order to keep people safe during this pandemic, we have had to close them during shelter in place. This means that we needed to change how we were doing things. So we have expanded Meals on Wheels, really expanding our meal delivery, and also we have provided up to 10 to 20 microwaves to individuals who needed support in actually reheating these meals throughout the week that they got through this delivery program. Along with that, we have also shifted our in-person wellness checks to being on the phone to make sure that our community members are doing okay, and then of course taking in any needs that they may have and being able to meet them. And then of course, finally, all of this is happening under the guise of the pandemic, and we have made sure to consistently provide testing resources to all of these different communities, especially those in our congregate shelters or our congregate facilities such as homeless shelters, as well as our skilled nursing, as well as long-term care facilities in Berkeley. Let's go to the next slide. All right, so I've talked a lot about our boots on the ground work, what's been going on in the community, but a lot of the community has been spending a lot of time at home. We've also been spending a lot of time on our computers and digesting a lot of different news and resources. So this brings us to our public information and outreach. Our primary goal of our public information and outreach has been to provide up-to-date information in a timely manner to give people the tools and the resources that they need in order to keep our community safe. We have seen visits to our website drastically increase, as well as our followership on social media and other public outreach channels. This shows us that people are looking to the information that we are publicizing and demonstrates the trust that our community has in our communications. This is a trust that we do not take lightly, and we are very proud of and hold dearly. As you can see from some of the stats on the slide, we have 52 community messages that have been distributed directly to our community members, and they have 1.3 million views across all platforms. These messages are distributed for new public health officer orders and additional resources that accompany them, as well as Sarah mentioned, any protective actions that community members can take to help mitigate the spread of COVID-19. This is also accompanied by emergency radio updates on 1610, social media engagement, as well as continued engagement through traditional media channels with some of our local news sources, as well as national news sources as well. We also want to ensure that all community members can receive our COVID-19 information as quickly as possible. So we have completely revamped our city website to highlight a variety of COVID-19 resources that can be found at cityofberkeley.info/COVID-19. This also includes localized data for Berkeley-specific COVID-19 cases through our data dashboard that again was one of these resources that was built overnight from the ground up. We also very early on procured translation services, which allows us to quickly translate any of these materials that I have described to our non-English speaking community members. Building off of that, we have a complete webpage that is dedicated to our Spanish language community to provide them with specific resources throughout this pandemic. Because Berkeley is not isolated in this, we continue to have close coordination with Bay Area public information officers, as well as local public information officers, such as with our partners at Berkeley Unified School District. Finally, our outreach library allows us to support our community, both in their business and arts community, as well as individuals with signs, posters, and any other materials that they may need to help community members follow all of these different COVID-19 protocols. The work that I just presented, it scratches the surface of the work of our Joint Information Center. I want to especially thank our public information officer, our digital communications coordinator, and disaster service workers from the Berkeley Public Library, City Clerk's Office, City Manager's Office, Health, Housing, and Community Services Department, or HHCS, as well as Public Works. Let's go to the next slide. So, as I'm talking about all of these, I know that they're framed as accomplishments and just incredible work that we've been able to do, and just really, again, extending my thanks to the mayor as well as the city council for their leadership and quick thinking, especially around how we support our business and arts community. But I do want to take a second and acknowledge that the economic impacts of COVID-19 have been immense. And although we have been able to do so much, there is still so much left to do. And there is so much recovery and adaptation that needs to happen in order to continue to move through this pandemic. So from the outset of this pandemic, the city has supported our business and our arts organizations by connecting them to information, funding opportunities, as well as enabling them to do business outdoors. Some of the activities we are particularly proud of for these particular activities is documenting the scope of economic impacts over 300 Berkeley businesses and arts organizations have experienced in order to make Small Business Administration, or SBA loans, a national program readily available to businesses across Alameda County. As you can see, this is another example of a joint coordinated effort across jurisdictions. Along with that, we have been distributing business and arts continuity grants, which was something that happened within 6 weeks. Again, really speaking to that, something that would have taken months has now taken weeks. And this was an effort, again, really supported by our mayor, our city council, as well as our city manager's leadership in order to get this off the ground and then quickly implemented within our community members. This grant operation was supported by multiple disaster service workers who worked around the clock for about a week and a half to review over 1,500 applications and then provide almost 800 awards that you see reflected on the screen. This work was supported by our planning department, our city clerk's offices, as well as our Berkeley Public Library. Thank you all for your quick efforts. Along with that, our finance department implemented a tax deferment program which helped participating businesses stabilize their cash flow while they organize their businesses financially. Really, again, speaking to that type of gap support that we have been able to provide to support our business as well as our arts community. Along with that, we wanted to make sure that this wasn't just a one-way street. So in April, we established the Emergency Business Outreach Team, which conducted multiple surveys as well as in-person outreach of our local businesses. This team went to all 10 of our different business districts to do a survey of what was going on and kind of who was open, who may have closed, and then work with those who were open to see what some of their points of feedback were, as well as identify specific needs they may have had. Along with that, because we knew we weren't going to be able to see everyone in person, we also did approximately 5,000 business surveys and 800 phone calls on the direct impacts of COVID-19. We have also conducted additional outreach through over 40 sector-specific business as well as arts community listening sessions, which were also greatly supported by our mayor and our city council. Thank you again for participating in those forums with us and being able to hear what our business community, regardless of their sector, was able to provide in terms of their experiences with the pandemic. This consistent engagement continues. It went from being weekly to now monthly, and it continues to help us identify key areas where business and arts organizations are struggling and in need of more support. It also helps us learn a little bit more about some of the successes that businesses and arts organizations have had, even during such a difficult time. I also want to take a pause and really thank the Berkeley Chamber of Commerce, as well as the Berkeley Cultural Trust for their engagement in these forums. Outside of these direct outreach efforts and collaborative forums, we want to be able to have these resources available to anyone in this community at any time. So we have a specific webpage dedicated to information for businesses, where businesses can go to get more information about what to do if there is a workplace exposure, an incredible collaborative effort by members of our Emergency Operations Center, as well as, again, get those outreach materials that I was mentioning earlier. Of course, I want to highlight the work surrounding our outdoor commerce program. And through this program, we have been able to adapt 3 pre-existing permit processes, our street closure permits, sidewalk seating permits, as well as parklet permits, to expand outdoor dining, as well as other opportunities for businesses to adapt their operations during this time. Of course, as I close this slide, I do want to recognize the incredible customer service support that has been provided by not only our business liaison, as well as our Office of Economic Development, and finally, our business support specialist, who is a disaster service worker from the public library. These individuals are directly responding to businesses as well as community members in response to COVID-19 questions and concerns about a variety of requirements, as well as what has been put out in our health orders. Thank you for your efforts. All right, last but not least, let's move on to cost recovery. Next slide, please. So at the outset of this response, our city manager directed staff to account for costs for the entire COVID-19 response effort. Under her leadership, we were able to work with all departments and continue to work with all departments to ensure that all financial resources are well deployed as well as coordinated throughout this response. We don't want to be duplicating effort, especially when it comes to money. In March, we established a multidisciplinary cost recovery team, which is housed under the EOC's finance section. Since that time, the team has worked closely with departments to monitor developing funding sources, and as the city receives COVID funding from different funding streams, whether it's federal, whether it's state, we are able to quickly apply these funds to maximize the impact. One of the examples of this is that through the Coronavirus Relief Fund, which was part of the CARES Act, the city received an allocation from the state. We made sure to allocate these funds to expenses that could not already be recovered through the FEMA Public Assistance Program, that program that I mentioned earlier that we're working really hard to make sure that we can be best positioned to get reimbursed from if they accept our application. So this process of getting reimbursed through FEMA is a meticulous and time-consuming endeavor, and the team has had to adapt to very frequently changing FEMA guidelines in order to support this effort. To help us navigate this process, we have brought on a cost recovery contractor and have implemented a detailed documentation process to ensure that every cost, as well as every hour of employee time spent on this response, is accounted for to help increase our chances to be accepted as an applicant for FEMA public assistance reimbursement. We anticipate that this process is going to continue over multiple years, and I want to thank the mayor and city council for their continued support of these specific efforts. As I wrap up this section, I do want to highlight that this is just part of the incredible work that has been done to respond to, as well as mitigate the spread of COVID-19. Though all of these are outward-facing efforts, we have also activated many EOC internal administrative functions, as Sarah mentioned earlier with that situation status report, to ensure that we have a well-documented response and have frequent opportunities to coordinate with each other in order to avoid duplication of effort and also answer some very difficult policy questions that have come up throughout this response. With that, I will close out my section. Thank you all for giving me the time this evening, and I will hand it over to our Deputy City Manager, David White, to discuss some of these organizational impacts.